name is Meg Hager, and I'm a laboratory genetic counselor for Natera's Renasight test. I will be discussing negative genetic test results in kidney disease in a three-part series. This is part 3. Many of us are probably familiar with this scenario. Imagine that you have a patient in front of you with a personal and possibly a family history of kidney disease that is suggestive of a genetic disorder. So you order genetic testing, it's sent out to the laboratory, and a few weeks later, results come back. However, when you open those results, you see that the patient has a negative or inconclusive test result. And so at this point, you may have a few different questions going through your head, such as, why are they negative? What do I do next? And what do I tell my patient? In this video, I'll be addressing the third point on the slide, which is how to discuss negative genetic test results with patients, including familial risk. So here are some of the talking points to consider when discussing negative test results with a patient. The first one would be negative results may not rule out a clinical diagnosis of kidney disease. However, the results may reduce the likelihood of a genetic cause. We can always think about how our understanding of genetics relating to kidney disease will change over time. And we should also still consider discussing familial risk, even in the context of negative test results. I'll go into a little bit more detail about each point listed on the slide and also provide you with maybe some phrasing that you can use in your own clinic. While genetic testing can be used to help pinpoint a patient's disorder, especially when they have clinical symptoms that might be explained by a number of different genetic causes, a negative genetic test result doesn't negate the clinical presentation that they have. And by that I mean it doesn't negate their symptoms or the need for clinical follow-up. And in some cases, it might not negate the clinical diagnosis that they do have. From my understanding with ADPKD, there's ultrasound criteria that patients can meet, as well as family history criteria, and with those combined, they may still have that clinical diagnosis of ADPKD, and a negative genetic test result doesn't necessarily take that away. We do know from studying ADPKD that approximately 7 to 10% of individuals who meet that clinical criteria might not have a genetic cause identified on testing, and so it's still important to follow those people who meet the criteria that's laid out. And I suppose it would also be important to follow people who may not meet that criteria necessarily, but still have cyst or other concerning kidney disease symptoms. So using that ADPKD case as an example, if you have a patient in front of you who meets that clinical criteria for ADPKD, but their genetic test results were negative, you could try saying something like, your genetic test results did not tell us the underlying cause for your personal history of polycystic kidney disease. And I think you can, reassure the patient that what they have is there and it's real. We just don't know the genetic cause at this time. And then you could discuss what follow-up would be most appropriate for them. Again, we know that genetic testing could be used to help clarify somebody's diagnosis, especially if it could be related to multiple genetic causes. And a negative genetic test result might help narrow in on the underlying cause of the patient's disorder, especially if they are affected by something that could have several genetic and non-genetic causes associated with it. And so a negative test result in this case would reduce the likelihood that they have a hereditary condition that's underlying that. And I think it's important to keep in mind here that the negative test result is not necessarily going to change their course of treatment or medical management. If we think of FSGS as an example, in this case, we know that there are variants in several different genes such as APOL1, INF2, and PAX2 that have been associated with hereditary forms of FSGS, but we also know that FSGS may be associated with other non-genetic things such as viral infections, medication use, and certain medical conditions. In this case, when you have a negative genetic test report, and there are multiple etiologies that could be considered, you could say something along the lines of, your negative genetic test results reduce the chance that there is a single gene cause underlying your personal history of kidney disease. I think it's important to remember that our understanding of genetics as it relates to kidney disease will likely change over time. And so it's possible that we're going to be learning more about these disorders in the future, especially as more patients with kidney disease have genetic testing ordered for them. So it's possible that we could learn more about the etiologies or genes related to certain conditions. And it's also possible that more variants will be reclassified over time. And so we'll have a better understanding of which variants relate to disease and which variants are benign. An example of a hereditary condition where we don't know all of the genetics yet would be branchio-otorenal syndrome. So we know about 50% of individuals who have that clinical diagnosis do not have a genetic cause identified in testing. And hopefully in the future, we'll see a greater understanding of maybe what causes that condition and can give a genetic diagnosis to more people. In this situation where you have a negative genetic test result where the patient's presentation might still be suggestive of some underlying genetic factor, you could try saying something like, while we didn't discover a genetic etiology for you at this time, our understanding of your condition could change in the future. It may be beneficial to revisit genetic testing in a few years. A common question we get from patients after they receive a negative genetic test result is, are my relatives still at risk? In many cases, the answer may still be yes. At this point, genetic testing has reduced the likelihood that they have a monogenic cause underlying their history of kidney disease, but genetic testing cannot rule out any multifactorial or polygenic risk that could be underlying that. And it's also important to acknowledge that everybody has some degree of risk to develop kidney disease in their lifetime, so we would likely recommend that somebody with a family history of kidney disease discuss that family history with their healthcare providers to determine what screening and management would be most appropriate for them. It should also be noted that this discussion will be a little bit different if you are testing somebody with a known family mutation. And in that case, their risk estimate may be a little bit different in that if the patient does not have that familial variant, then we would not expect them to develop the symptoms of that disorder, and their children would not be at risk to inherit the familial variant from them. However, if they have other relatives, such as siblings who have not been tested for that yet, they could still be at risk for the familial variant and would need to consider following up with their healthcare providers to undergo testing for themselves if they were interested in that. So when you're discussing familial risk with your patient, you may want to say something like, your relatives may still be at an increased risk for kidney disease and should follow up with their healthcare providers accordingly. In the event that there is a known familial mutation, you could discuss with the patient that their relatives who have not had genetic testing for that known familial mutation may still be at risk to have that, depending on their relation to the person who tested positive first. And again, they should follow up with their healthcare providers to figure out what the next best steps for them would be. If you have a patient who still has additional questions or seeking additional information, it may be a good idea to refer them to a genetics provider, such as a genetic counselor or a geneticist, to continue that discussion. There are links on both the National Society of Genetic Counselors website and on the American College of Medical Genetics and Genomics website on how to find a provider either in your area or via telehealth. And that's the end of video 3 in the 3-part series related to discussing negative genetic test results. Thanks so much for listening.